Hey, welcome to this week's edition of Spotlight on Jackson County. I'm Michael Paul, your host, and happy to have in the studio with me today Richard Lucas, the Director of Communications for Singing River Hospital. It's great to see you,
Mike. It's always good to see you, my friend.
We haven't had you in a while. And
been about a year. What's the deal on that?
I don't know. You know, I just thought about it the other day, and I said, golly, we hadn't had Richard here in a while. I'll tell you how it happened when I called you to ask you about Dr. Ikenna.
Dr. Ikenna, good man.
Which, by the way, quick programming note, next week, Dr. Ikenna, who is a infectious disease specialist, will be on the show here with me, and I'm looking very forward to that.
And people need to watch that show. Michael knows this guy is a really sharp, interesting guy, great man for our medical staff, and you're going to enjoy talking to him.
Yeah, you know, he just, excuse me there for the producer, I just reached in my pocket to get my pen, and I'm sure I knocked the microphone there. But anyway, you know, I was talking to him in the last few weeks because of my father.
Right.
And you're familiar with that. He's had some problems.
Yes.
Dr. Ikenna is his doctor.
Tell Walter Lee I said hi.
I will, and he'll appreciate that.
Good man.
But you know, I found him so interesting.
Yeah. Couldn't you just talk to him for a while?
Absolutely.
Fascinating guy.
And I don't want to create a show about Dr. Ikenna before he gets here, but I'll say real quick, he speaks British English, and he is from Nigeria.
I think that's right.
Or either Kenya. Nigeria. We'll find out for sure next week. But in any case, he's one of the brightest individuals that I have ever spoken to in my life. And I'm looking so forward to interviewing him next week.
You'll enjoy it, and you'll agree with this too, Michael, real quick. Just a good guy, to get that twinkle in his eye, doesn't he? Just a neat guy. All right.
He's a good guy. But anyway, let's talk about Richard Lucas for a minute. You know, Richard, I was telling you before we started the show, golly, I've known you for so long, and I don't even remember how long you've been at Singing River Hospital. I think you've been there all my life. But I'm not sure.
It feels like I've been there all my life. 27 years. Went there in 1981, February 16 in 1981. And, you know, was glad to go to that position. I was excited, never expected to necessarily be there for 10, 15, whatever years, but it's just become a position that I've really enjoyed very much. I really love what I do, and 27 years later, I'm still doing it.
Did you start out as communications director? Where did you start?
I did. You know, it was when I came to the hospital system, Michael, there were only 5 PR types in hospitals in Mississippi. It was a new thing. Hospitals did not, at that point, feel like they wanted to go that way. They felt like that they just stood on their own. They were kind of iconic. Well, we're up here, we're the hospital. We don't have to tell people what we're doing out here.
Yeah.
You know, and then, of course, that never was really accurate. And hospitals, I believe, suffered from that over the years of being kind of secretive, and we don't really know what's going on out there. And then in the 80s, a wave came of, you know what? You need to communicate. Let's talk about what's going on out here. Something.
Well, and you don't have a unified message, Richard,
right,
which is where you help. You put all the pieces together. Yeah, and you put the unified message together for the public.
Well, you make a great point, and of course you're knowledgeable about this area. I am the spokesperson. You don't need 30 people speaking for anywhere, whether it's a bank or a department store or a hospital system. You need a unified message.
Even the President of the United States has a spokesman that says
secretary.
Yeah, the press secretary.
You know, and you need to do that, and we did it. I was the 5th one in Mississippi. Now there are 85 practicing PR professionals at hospitals in Mississippi, so I'm kind of proud that Singing River Hospital System was on the first wave of that. And the rest, as they say, is history. We've grown the department, we've grown the function, and it's a way that I guess the reason I like it so much, Michael, is I feel like I'm possibly at least trying to help a lot of people every day, because so many people come into the hospital system every day, need our services, and I feel like by me being in that position of communications, maybe we can help a lot of people.
You know, the hospital is just like any big company, institution, kind of political. How does a guy survive 27 years in an atmosphere like that with different supervisors? You know, people don't understand. Supervisors appoint trustees to the hospital. Trustees manage kind of the overall picture of the hospital, and then you've got your CEO, Chris Anderson, and before him was
Robert Lingle.
Robert Lingle, my friend.
Well,
Robert Lingle, yeah.
Your friend, and a brilliant man in his own right, and I'll bridge over and throw a kudo toward Chris and Mr. Lingle. I've always thought that is one of the most difficult jobs in probably in any county, in this county, because they're the CEO of the major healthcare institution. Now, that's big enough as it stands, right? But who, and you were touching on it, and again, you're knowledgeable in these areas, who does he have to please? He's got to please our board of trustees, which is a 9-member board, very good board, very active, hands-on board. But he also has to pretty much answer to the county board of supervisors, because we are you remember those days, we're a county. And then how about a 200-person medical staff?
Yeah.
Because they're all going to come to him and go, hey, we need a new machine, we need this, we need that, and 2,400 employees.
Physicians aren't exactly the easiest people to deal with.
Oh, they're just so easy to deal with, and they're great friends of both of ours. But physicians,
but they've got their views.
Let's just say they're rather strong-willed.
Yeah, I'll agree with that.
So that position there, and then certainly I report to Chris, and he and I do a lot of things together. It's pretty interesting.
I bet it is.
But challenging in a good way.
27 years, though, I think you need a little kudos for just being able to survive that environment for 27 years. You've obviously done a great job, Richard. And I appreciate the things that you've done for me personally and for the hospital. And when I was on the board of supervisors, I always had an open line of communication with you, and you and I always talked, and I appreciated it.
And that's
really
a good thing. And then likewise, because we knew with you on the board, we always had a sensible person that wanted to know. Think about you, Michael.
Somebody may argue with you on that one.
Well, and with me, and here we are. But you always want to know the facts. And I always appreciated that. You weren't like, Richard, I think we're going to try this. You go, Richard, tell me what's going on with the blank situation, and then we'll deal with it. You wanted to know what was going on out there, and that's why you were a good supervisor.
I'll just give you a brief, for instance. When you're 30 years old and you get elected to one of the most powerful positions in the county, you have to ask a lot of questions because you don't know very much. And so
was smart instead of faking it.
I guess it is smart in a sense. But I enjoyed my time on the board of supervisors, and I enjoyed working with the hospital.
And you and I are two that can explain to the public a little bit how that works, because it is really a real neat bond, I would say. The supervisors, our board of trustees, and our management team. And I think we had a great, let me say this, of course I would say this, but I think we got a really neat, we call it senior management team, because it's real diverse. You got Chris, who's young. Chris will tell you, he's getting on up there a little bit now, but I'm just saying when he started, he was very young.
Age, I think.
Yeah, he's about your age, and doing a great job. Been there, Chris, this is interesting. Didn't mean to, we're having
we're
fun
talking
with
about
the
Chris
Ken
Anderson.
and Chris there. Yeah. But just things come up, and you and I tend to have a nice free flow to our conversations. June 1, which is 2 days ago, was Chris's 10th anniversary as CEO.
Gosh, it doesn't seem like it's been that long, you know?
It seems like it's been there 4 or 5 years.
It's amazing.
And he and I were talking about it, and he was like, you think me and the 27, but relatively speaking, Chris kind of like, Richard, 10 years, man, what's the deal there? I didn't know I'd make it that long, because these are high pressure positions. But we got Chris, and then we've got a couple of guys with a few barnacles on them, like Nebo Carter and myself.
Nebo, one of my great old friends.
What's the guy?
Love that guy.
Human Resources Director Mike Cruz, who's relatively new, but about my age of experience, is our Chief Financial Officer, and then a couple other younger guys. You got Lynn Truelove at Singing Rivers Administrator, and Kevin Hollins, Administrator at Ocean Springs, and and I can name some more, but we want to get on to some clinical issues. But pretty good team, don't you think?
It is a great team. I'll tell you what I want to do. First, I want to finish. We've got about 3 or 4 minutes left in this segment. I want to finish talking about Richard Lucas, because I'm interested.
History of Lucas.
Yeah, I'm interested in his. I wrote it down here, and Richard said maybe there need to be a book like this. It sounds like a biblical book. The History of Lucas, or the Book of Lucas.
Hit me with another.
Well, what I wanted to ask you about is because we've all known you for so long as the communications director out at Singing River.
Yes.
What did you do prior to coming to Singing River Hospital? And I know you're a Pascagoula boy, and you've been here all your life.
Pascagoula boy, and now Pascagoula. You and I are similar that way. We love our hometown, and here we are. But when I got out of school, of course, I'm an Ole Miss guy, but I came on back, and I went to work for Northrop Grumman, Ingalls at the time, and my little comment I said to you off air, and I think you'll kind of agree with, you kind of can't live in Pascagoula and not touch Ingalls somehow. Both my dad and Michael's dad were good friends at Ingalls on the management team in the 50s and 60s and 70s, and that's a good memory for Michael. And every time I see Walter Leo go, Richard, Max Lucas was a good man, and that makes you feel good when your dads know each other, that kind of thing. But I was there as a technical editor.
What is that?
Yeah, and it was kind of neat, man. You got the engineers, and God love them, and they're really bright, and we got a ton of great ones at Ingalls, and they put together the ship manuals, how to build a ship, how the ship works. but the guys can't write. They can't write to where you can read it. So
a common guy can understand what they're saying.
They would take us, we'd sit in our little area there, the technical editors, they'd bring us these huge piles of written material and say, make this where the average guy can read it.
Perfect.
So that was an interesting job. It was good training.
Good training for you where you came, because you're not a doctor, but you have to understand what doctors do and what hospitals do.
And I already had a little feel for taking something and making it.
Right.
But in between, real quick, if we've got time, I'd like to mention a job that I really enjoyed was after I left there. I worked for the State Employment Service for a while and really enjoyed that. I was the public information officer, and we interviewed people for jobs because everybody that worked there had to help people find jobs, and I enjoyed that. My background had been personnel as well as PR, and my degree from Ole Miss, and so I was enjoying that. And one day a job came in, true story. Looked at the sheet for that day, Ingalls needs this and Wayne Lee's needs that. Whoa! Cinderella Knitting Mills needs a personnel director.
Wow,
I think I know somebody who might could fit that. So I sent myself on the interview and got the job.
Great.
It was neat, and a lot of us remember Cinderella up there on,
absolutely,
Jefferson
Street.
Jefferson
it's the border
Street,
between Moss Point and
Moss Point. Right down the road from where I was born in the old hospital. And worked for a wonderful guy named Charlie Clark, great garment industry guy that came here to run the factory, and he turned me loose. He made me personnel and PR director. We had 500 people working there, mostly women, and we made men's underwear, and it was some of the best underwear you'll ever see.
Now, you were telling me before the show you still actually have some of these men's underwear.
I still have some Reeves Brothers underwear, because Reeves Brothers was the parent company up in New York. Used to love to go up there. Michael, Avenue of the Americas, the garment district. If you've ever been up there in New York City, and Reeves Brothers had 35 factories that made men's underwear amongst all their other holdings, and we were always in the top 5 producers every year. And I was real proud of that. Go to the Carolinas, that's big textile country, and we go up to Spartanburg, South Carolina, Charlotte, North Carolina, go to meetings, neat, and really getting to know the garment industry. Really liked it, but after I'd been there 3.5 years, Reeves Brothers shut us down because we were unionized, and this is a union town, and that's an okay thing. Doggone, it's a good blue-collar union town, and Reeves Brothers was like, hey, we don't have union companies. We let y'all go for a few years because you produce so well, and it was their ball, and they took it and went home.
It's funny. Now, we started talking about the hospital and Richard Lucas, and now we're talking about men's underwear.
Men's underwear, a pretty good segue, don't you think?
That's great. Look, I'll tell you what, hold on just a minute. We're going to take a quick break, and we're going to come back, and I promise you we're going to talk about some serious issues when we come back.
But I got to finish the story about Reeves Brothers and the hospital.
We'll finish it when we come back. All right, we'll take a break. Be right back. Welcome back. Spotlight on Jackson County. Michael Paul here with Richard Lucas from Singing River Hospital, and we were discussing before the break, Richard, about how you got to where you are today, your 27 years of service at Singing River Hospital, but how you got started. And one of the jobs that you had before you came to the hospital was at we call it the Cinderella Mills.
That's it, Cinderella Knitting Mills.
It was the knitting mill, Jefferson
and real quick knot on a little quick notch on that. I hate to see that thing go. That was 500 good jobs. I don't go a week, Michael, nowadays where I won't see usually a lady, because it was mostly ladies, seamstresses, that kind of thing, to say, hey, Mr. Lucas, Cinderella. And I'll go, wow, yeah. People loved working out there. We were putting out T-shirts and underwear and just all kinds of stuff. It was great, and I hated to see it go. But it did go, and this was early 1981, and there I am, a young man, as they say. And
with a family?
Well, here's the story. Young man, my wife's a school librarian, and we're loving being back here. And Mary John was pregnant with our first child, and whoa, Dad ain't got a job anymore.
Scary.
It was a scary feeling. It was kind of weird, but and I've seen you do this in your life, and I'm not saying you don't have to have some good fortune too, but I've always tried to be a half full guy, and I was like, you know what, I'm gonna find another job.
Yeah.
So I went out and I went to all the places around Jackson County, wrote letters, made a couple of calls. We shut her down in January 30 of 1981, and in February 16 of 1981, I went to work for the hospital system. So by golly, I ran out there and grabbed me something. And again, goes back to what you're talking about. We were talking about briefly, and then we'll move on. Is that hospitals were just seeing the light that we need a communication function, and that's what I sold to Robert Lingle, and I'll always be indebted to Robert Lingle for
giving you
agreeing. He was like, "You're right. We do need somebody like that." And I was like, "Yep," and I'm the guy. Worked out, huh?
It worked out. It's been very good for you, the county, and the hospital.
Hopefully.
What about Reeves Brothers? You finished? Were you finished with that?
Yeah. Let's move on.
Okay.
I waxed a little poetic there, Michael, because I enjoyed those years. Those were good years. But let's talk some more about Senior Hospital System.
Let's talk about a big issue that's come up. There's a special session in the legislature going on all about Medicare.
Right. Medicaid.
I'm sorry, Medicaid.
I know.
Thank you for correcting me.
I do it all the time.
Sometimes I can hardly tell the difference, but in any case, there's going to be a tax now on hospitals.
Very
right?
probably, yes. The way we
I was opposed to that, Richard. I'm just going to tell you, and I spoke about this months ago.
Yes.
I think that, and I agree with Haley Barbour 90% of the time, but this is one of those 10% of the times that I do not agree that you ought to tax sick people. I just don't think you ought to do it. It just doesn't make any sense to me, but it's probably going to happen. So you tell me, what's the hospital's position on this, and what's going to happen with Medicaid?
Okay. Thankfully, Chris Anderson, our CEO, was tapped by Governor Barbour to be on the very small committee to study this. And he and several other hospital administrators, Haley said, would y'all sit down? Can't you just hear Haley? And we got to figure this out. And basically, I'm going to capsule this. You don't have a lot of time. This is one thing you talk about for 3 hours. Right. We don't want to do that. I don't want to do that. You don't want to do that. But basically, here we are. Medicaid is underfunded by about $90 million this year, okay? And I know it sounds like a lot of money. It is, but Michael's been around government. You hear huge figures to do huge jobs. But it's really more severe than that, because this, and you've heard of these, Michael, this Medicaid across the nation, not just Mississippi. And by the way, this is a problem across the nation, not just Mississippi. I want that understood. California's having a devil of a time with Medicaid. It's an epidemic
across the country.
So nobody needs to go, oh, here we go, Mississippi having trouble with something again we shouldn't have trouble with. This is very much across the nation. It's a match deal. The federal government will match what the state comes up with, and say, look, if your total budget is this, we'll pay 75% of it, okay? But you got to come up with that first quarter. So you really do the simple math. It's a $360 million deal.
Wow.
We come up with a 90, then they'll come up with a 270, and it's 360. But if we don't come up with a 90,
the 360's gone.
It's gone. It's the 270 to make 360 is gone.
Yeah, okay, I understand that.
So it's a big deal. So we got to do it because you got to take care of these people.
So it's just a pill you got to swallow?
It's a pill. Well, listen to me. So what we would like to see happen, I say Senior Hospital System, the Mississippi Hospital Association, there was a proposal out there, I guess it would have been in the House, yes, to tax cigarettes. And that's what we feel like needs to be done. South Carolina did it successfully. But the Senate doesn't want to do it, and Governor Barbour doesn't want to do it. So, Michael, you've been in the arena. You have to start being savvy and looking at here's what we wish would work, what will work. Now, what looks like it's going to work is a tax on hospitals. Do we like it? Of course not. You verbalized it well.
I just don't agree with it.
You're taxing the places that are taking care of sick people, which means you're ultimately taxing the sick people, and you got it exactly right. But would we rather say, well, we're not going to do that either, and then there is no Medicaid? You can't do that.
First of all, there's a fallacy about taxes that I don't think people clearly understand, and that is, if you tax a corporation, corporations don't pay taxes. Corporations pass taxes along to the patient in your case, or to the consumer in the other case. But this is going to be passed along to the insurance company, to the patient, and I just disagree with it. I mean, and taxing cigarettes, I disagree with that too. I mean, there's enough taxes on cigarettes, I think, to this day, and it's almost a hypocrisy, and I don't want to get on a roll here.
No, don't get on a roll, because we got time.
But, what's next? Twinkies or fattening food? I mean,
maybe, but don't get on a roller. But what would you do? We got to have Medicaid.
I know you got to have it. I just don't know that, it just doesn't make sense, and I'm having trouble putting that together in my mind, taxing sick people.
All right,
why don't we just make them pay the bill?
Well, it's not that easy. It's not that easy.
I know it's not. It's a complicated issue. That's why we could talk about it for 3 hours.
But what you and I both understand, and heck, we're agreeing too. This isn't even a counterpoint, but where I want you to get to, and with me, and so the public can try to get their arms around is we got to have Medicaid. So it's kind of like a lesser of evils.
Yes, I agree.
There probably will be a tax on hospitals, which we will agree to. Because we're good stewards. You've got to have Medicaid. You can't tell this large group of Medicaid patients we have right here in Jackson County, I'm sorry.
Yeah, we can't.
There are no
we can't
funds
treat
for you.
Yeah.
So we can't treat you. You can't do that. So you're probably going to see this happen, and it's tough. It just goes to show you there's some tough decisions have to be made about health care.
I'm going to tell you that an old friend of mine, Carol Clifford, who used to be on the Board of Supervisors.
Oh,
with me,
Carol.
And I don't know if he coined this term. I'm sure it was around before Carol, but he certainly used it, and I remember it. And he looked at me one time, and he said, because I was a lot younger than Carol, being 30 years old, elected to the Board of Supervisors, and he said, "Son," he said, he said that we don't have any problems that money won't solve. And so, that's pretty much the case here.
I mean, man, he may have coined that.
It's a true statement.
But it doesn't make everything okay, and that's what you were saying a while ago. Hey, you want to talk about a couple other things?
I want to talk about Ocean Springs Hospital.
Sure.
That's a growing community over there. Ocean Springs and Singing River Hospital system has done a lot to increase the services in Ocean Springs. Tell me a little bit about what's going on in Ocean
Absolutely, and as you pointed out, a real growing part of the county, and always been a real neat hospital, growing into a great hospital in its own right. We're just so proud of both hospitals, Singing River and Ocean Springs. Ocean Springs, you noticed this, Michael, just turned 40?
Yeah, I noticed that.
40th anniversary. How about that now? 1968.
It's amazing.
Opened the doors in April of 68. Just, minimal beds. Get this now, 4 doctors. Three or four doctors, Now we got on staff 200 doctors. Basically, and 100 or so that actively work there. Look, it's a great hospital, and we've done some neat things over there. We've got a new emergency department that's really state of the art. It's really great. You don't want to have to go into the emergency department, but people do.
You know what we ought to do, Richard, and I'll pose this to you. We ought to go over and shoot a show at the emergency department at the new one and talk to some of the doctors and the nurses and the folks over there. If you can get Chris Anderson to agree to it, I'll go over there and we'll take the cameras.
If we stay out of the patient care area, we can do it. You can't go into patient care area, HIPAA. We don't want to go there.
Yeah.
But that's a Health Information Privacy Act.
That would be a very interesting thing for the folks of Ocean Springs and Jackson County because it's a nice new facility.
It is. We've got that, and we've got a renovated cath lab, and just several areas over there have been updated to the point that you go in there now. If you hadn't been in Ocean Springs Hospital in 8 or 10 years, you'll be surprised. That's 136 beds now, and trying for more. You remember that issue from a year ago, and we're finally going to get a few more. Boy, that certificate of need process is bizarre, isn't it?
It is the most amazing thing, and I still am not sure that I can quite comprehend exactly why that it has to go through such a difficult process. Can you just give me an overview of that?
How about another show? Can we do a whole show on that?
We probably ought to do that. But what we're talking about...
I'm not ducking you at all. I want to do it. But let me bring a guy with me that deals with those. That would be a whole show. And you like stuff like that.
Do.
You like getting to the meat of the coconut.
It's like this. I mean, we've got a hospital system here in Jackson County that has a need. It has a need for more beds.
Right.
And you have to go through this act of nearly Congress hoops.
Let other hospitals appeal and say they don't want you to have it.
Your direct competitors can stop you from doing it.
And we said we were going to do it later, but briefly, and you'll understand this. You do have to have a system. We are not against the system. If there wasn't a system, then Joe Blow Hospital could blow in here from Florida over here in Creole and go, we're just going to build a big old OBGYN unit, which really isn't needed, and skew things. So you got to have, and that's why it's
some
called
controls.
Certificate of Needs. You got to have controls. But boy, the way it works sometimes gets bizarre.
It needs to be revamped, I think. And that's a whole other show, like we said.
But we're getting some more beds over there, and so that's a good thing because that is one busy hospital. Kevin Holland, administrator, Dr. Kathleen Lee, and Heath Thompson, associate administrators, got a real neat medical staff doing great things over there 16 miles down the road.
All right, look, what are some of the other few little issues we can talk about in 1 minute? Because I'm getting pushed by the producer.
Kind of like the lightning around here. Quick, go.
Let's go.
Hey, boy, our 2 new heart docs and Eubanks, who you've met.
Yes.
We've had on WPMP, of course.
Yes.
They're doing great, and they recently passed the 100 surgery mark. How about that?
Amazing.
Now, Michael, and you know numbers a little bit since November when they got here. They've done 100, and I might add 100 successful heart surgeries. That's a great thing for
That is a
Jackson
great
County
thing.
because you don't have to go somewhere again. You know, we had Dr. Horowitz here. He did a great job. He left. Then we started having people having to leave and go places. Not any longer, my friend.
I think you're quickly starting to see a recovery from the Katrina effect of the hospital had. You know, doctors leaving. I mean, I know I lost my dentist but during the process.
Yeah.
And so I think people are
We
starting.
weathered that well, and we've strengthened ourselves. Yes, we really have. To where I'm going to tell you right now, it always has been, and I think always will be. We have a medical powerhouse here.
Yeah.
We are the healthcare center, in my opinion, for the entire Gulf Coast. There's no question there's some good hospitals in Harrison County, and I'm not saying they all come over here, but we are kind of the shining light of healthcare, probably from Slidell to Mobile, and I'm proud of it.
Richard, it's so good to see you again, my friend. Thank you for coming.
I'll be back. Thank you, Michael.
Let's do it again sometime soon. We got to wrap it up. Michael Paul here for Spotlight on Jackson County. We'll see you again next week. Thanks for watching.